Hey, Teacups, welcome to another live episode of Tea with Teash podcast. I'm your host, Teash, and today I have Meno Nurse Miss Amanda Otterman. And I'm going to tell you why this episode is so near and dear to me because I'm a perimenopause girly, and I know there's a lot of others out there, and we need answers. So, Amanda here is going to give it to us today. How are you?
I'm good. How are you?
I am good. Just waiting to get
Thanks
into
for
the text
having
so
me.
we can. Yes, of course, I had to. It was only right. So, of course, I made some notes because this episode is literally specific to me and my life, and I didn't want to miss a beat. So, how long have you been a Meno nurse, and why did you choose to be a Meno nurse?
That's a great question. Well, first of all, I've been a registered nurse for 25 years. Worked in many different areas of nursing, and a lot of years within the labor and delivery, women's health vicinity. That was probably about the last 10 years.
Okay.
Um, but anyways, I decided to this was probably after COVID. So like 2021 I left frontline nursing.
Okay.
And it was just too stressful.
I
To
bet it was. Healthcare is
put it
stressful, period.
put it out there. It was just right stressful. I was burned out and I'm like I needed a new direction.
Okay.
Um, and I myself at that time, I was 41, and really starting to feel the effects of menopause myself, where I really didn't even really know that that was perimenopause that was actually happening. I kind of didn't think about that because I had a partial hysterectomy when I was 33.
Okay.
So when I was 33 years old, I had a condition called adenomyosis and I needed to have a partial done. And a partial simply means they've taken everything but your ovaries.
Mm-hmm. Mm-hmm.
So my ovaries were still left intact and I was given the notion that having my ovaries intact, I would just go through menopause naturally like any other woman who hasn't had a hysterectomy. I've
Mm-hmm.
come to learn that that is not entirely true and that I've actually been experiencing perimenopause throughout most of my 30s.
Okay.
Especially towards the end of my 30s into my early 40s, my body was really starting to struggle. And I
Mm-hmm.
didn't really know what it was until I had actually decided, you know what, when I left nursing, I was gonna go more into the wellness space. And I did my certified personal training certification. And then I was like, I really want to work with women that are around my age, right? Like,
Yeah.
with my body type, with my age. I wanted a different approach to fitness because I myself had lost over 140 pounds. So I want
Okay.
to give back that way and like wanted to be different than what's out there. And with my nursing background, I felt I could sort of use that, but I wasn't sure. And then as I was going through other like continuing education courses, I came upon a certified menopause specialist. And I
Okay.
was like, okay, this rings. And as I was studying through it, I thought maybe I would just understand it just so I can work with women over 50. Like I even still had the misconceptions of like, oh, women over 50,
Oh
this is
yeah.
clientele. I was trying to build my niche and I was just like, oh, perfect clientele. I know a little bit of menopause. What I didn't realize was, oh my God, this is me.
Hmm. Yeah.
And oh my God, how many women are actually going through this? And like when you start breaking down all of the like not just physical but mental and sexual health and all of that, when you start
Yeah.
breaking that, like, oh my God, like the light bulb went off. And I was like, I need to deep dive into this even more.
Yeah.
So I took my menopause specialist certification and then I just like it just snowballed from there.
Hmm.
And I started to get fitness clients who were, yes, wanting to lose weight, but also with all these like perimenopausal things that were happening. And I even realized more that I worked with clients that people really didn't understand what was happening with their bodies.
Hmm.
So, long story short, it's been about 3 years that I've been doing this. But I mostly it snowballed from fitness clients who needed some perimenopause support where I really wasn't doing a whole lot of much into full blown like doing education for family health teams in my community and community partners, and
Okay.
just going out and doing those workshops and educating women. And I still have my clients that I coach, um, but a big part of what I do now is a lot of community education. And because you know what, doctors aren't doing it. They're not
They're
doing
not.
it. They don't have time either, or they're not comfortable even talking about menopause.
Yeah.
So just being in this space and learning so much, it's like it just snowballed, and people found out what I was doing in my community, and then I have agencies calling me and asking me, "Hey, can you do a workshop? Hey, can you do a workshop?" So it
Hmm.
just kind of grew into a life of its own.
Uh-huh.
Um, I really started to understand that the community had a need, and like I married fitness and my RN education and experience together, and here I am.
Okay. Well, we are really
Plus
glad to have
nursing
you.
experience, of course, but
Yes,
yeah,
I'm happy to
all of
have you. And like you said, doctors, they don't have the time to really educate you. And I think anything that we're doing triggers from something that we've dealt with.
yeah.
And around the time when I was 33, I had a total hysterectomy because I had fibroids. I didn't
Mm,
know that it was a total hysterectomy, believe it or not, until maybe a year ago when I saw my physician for my physical. I always thought that it was a partial, but no, ma'am, this is happening. This is in full bloom. So
so
um,
they took your ovaries too, and they didn't tell you?
they're gone. Everything was gone. And I
And
did
they
not
didn't
know
offer
that.
you hormone replacement therapy?
So the deal with that was when I first had my hysterectomy, my doctor told me, she said, "Well, I want you to go ahead and get a mammogram before you start the
Right.
therapy if you decide to." And then I was like, "Okay, well, I didn't really know what it was until she said, 'Well, we're going to start you on estrogen.'" And I will pick up a prescription of many a months and not really take them. And that's because I didn't really educate myself prior to a hysterectomy. And then afterwards, I kept hearing all this chatter about, well, if you start to do the estrogen pills, then that may push you into breast cancer, whether your family has a history or not. And I was like, ugh. So even now, I'll jump in and I'll jump out.
Mhm.
And it's like, what do we really need to do here? Because I'm 10 years post and
Mhm.
I'm going through it like the whole nine. And so that's where you come in because I'm like, should I talk to her again about a different hormone replacement therapy, or should I keep, running around trying to find certain supplements because I'm scared? And it's like, I don't want
Mhm.
breast cancer. Who does? And so
Right.
now it's time for my first mammogram, which I've canceled a many appointment, but I'm going. But yeah, I just need some support, girl, because when I found that out,
Yeah.
I was like, y'all took all my stuff.
And this is where a lot of the problem lies, right? There's so much misconception and misinformation, and a lot of it is driven by a really old study that wasn't done very well. Women are
Hmm.
scared. Doctors have been scared out of educating women.
Yeah.
And the like that whole hormone replacement therapy breast cancer thing has been completely flipped on its head.
Okay.
Um, the risk of HRT and getting breast cancer is about the same or less than drinking alcohol and getting breast cancer.
Mm, okay.
So it like your risk of getting breast cancer is probably more drinking alcohol than the HRT itself. Um,
Okay.
there's a lot of concepts out there that really need good education, and this is where the gap is, that I'm trying to fill
Yeah.
and educate and close that gap for a lot of women who are scared, who have been prescribed treatments and are afraid to take them. But it's really
Yeah.
sad at the same time that they have providers that have given them these options, or like,
Hmm.
given them these treatments or told them that they need to go do a certain test, and there's no explanation for it. They don't
Yeah.
give you education as to why you need to do these tests and why you need to take the hormones, right?
Hmm.
So it's unfortunate that you have been feeling like this for this amount of time, and now you're looking for that information, which is fantastic, because I think the more you educate yourself, and I think the biggest advocate for women is to educate yourself and to
Yeah, you have to.
to get the right education, right? It's like sifting through crap out there on the
Mm-hmm.
honest
Yeah.
with you. Um, and you really want to make sure that you're getting evidence-based, things that have been in a scientific journal, not the influencer that has 200,000 followers
Exactly.
telling you something else that actually could be harmful.
Yeah.
So, it's really, really important. And I tell everyone that education is like your first line of anything,
Mm-hmm.
when it comes to your own, not just menopause care, but at midlife healthcare in general and mammogram.
Absolutely.
Yeah, for sure.
I think that, of course, being in my early 30s, I didn't think anything of it. And you always hear that menopause is for the older lady. I had never heard of Peri until I became one of those involved. And there was no education. I didn't even know that African American women are hit heavier with fibroids because of the melanin and things like that. I didn't even know that we were just hit so heavy with it because we're African American. So there were so many things that I didn't know until afterwards, and I
We
I
just
could have
have so
possibly
much
prevented.
factors as Black women in
Yeah.
general. Like
Yeah.
our risk factors, and I talk about that a bit on my Instagram page.
Yeah.
um like Black women in general have risk factors that are very different from white women, from Asian women, from
Yeah.
South Asian women. We already carry some genetic markers that put us more susceptible to cardiovascular disease
Mhm.
and high blood pressure and all of, diabetes, metabolic syndrome. We're
Yeah.
more prone to that just because of our genetics in general. Um, so menopause care for us needs to be like, even more front and center, because we do carry more of those risk factors. And on top of that, if you want to, pull in the fact of all the socioeconomic factors that affect Black women, um,
Mhm.
like, medical care for Black women isn't the same. We all know that. I live in Canada,
Especially when we're giving birth.
and it's the same here, right?
Yeah.
We're stereotyped.
Yeah.
For us, they don't take us that serious because, of other stereotypes they may have about Black women. Um,
Mhm.
we tend to be stronger, perceived as stronger than everybody else. So like, we're sort of expected to kind of bury all of that. And of course, like my mother didn't talk about her body. My mother didn't talk about menopause. None of it.
Yeah.
Those things are taboo. So we don't get that education even growing up.
Mhm.
It's there's a lot of different things that affect, plus, generational trauma.
Yeah.
Um, Black generation trauma contributes to how we experience menopause too. So there's a whole bunch of like things that even affect us uniquely as Black women. Um, we
Definitely.
we go through so I'm going to back up a little bit. Perimenopause, I mean, seems to be a new term. And
Uh-huh.
really what it means is transition. It's that
Mm.
transition period from when your ovaries start to decline in function and they start decreasing the amount of hormones that they make to when you get your last menstrual period.
Okay.
It's basically that transition period. So that transition period is anywhere from 4 to 10 years. And guess who gets the 10 years?
Wow.
Women.
We are messed up, girl. I don't know why the guys have worked against us, but we
Black
are messed
women
up.
can be in that perimenopause transition for 10 years and then still continue to have symptoms beyond our last period.
Mm.
It just doesn't go away from, we have more intense hot flashes, more issues with like mental health issues. So
Yeah.
it's just it yeah,
Night sweats, all of that.
night
Let's talk
sweats,
about it
all of
because,
it.
baby, my night sweats, honey, I could have on two fans, have the window up, and all that, and still be sticking to the sheets. And so, my thing is, what's going on? What's tea with this? Because it gets hot. It gets hot. And my nights are bad some nights. So I said, you know what? I don't know if I need to just go ahead and try some supplement because I had stopped for a minute. I was like, let my body kind of detox and stuff like that and really try to find out what's gonna work. I know they have those
I'll tell
Ollie.
you what's working, what's not working. I'll
Okay.
tell you what's happening. What's happening is your body lacks estrogen. So
Yep.
estrogen in your body, like the estrogen in our bodies, estrogen, progesterone are made in our ovaries. If
Mm-hmm.
we don't have ovarian function anymore, or that function is declining because we are headed towards our last menstrual period, which is menopause,
Mm-hmm.
um, or you've had a surgical removal of them, now you've lost your estrogen and progesterone. And estrogen and progesterone, we have receptors for that all over our bodies. We have receptors for estrogen in our brain, in our blood vessels, in our heart, in our joints, in our gastrointestinal system, our gut, everywhere. We
Uh-huh.
have receptors for estrogen. So if these receptors are no longer getting that amount of hormone that they're used to, we're going to have symptoms. And
Mm.
that's the foundational reason why we have the symptoms we have in menopause. No supplement is going to take that away. There are things that we can do to support our body, but really at the end of the day, the problem is that lack of estrogen.
So what do I do? Because again, I'm scared to take the estrogen and I'm 10 years post. So is there really a
So
way to for that to work this late in the game?
estrogen will work at any part of the game. The
Okay.
part that needs to be done is your doctor needs to rule out if you still remain a good candidate because you have been estrogen deficient for 10 years.
Mm-hmm.
Now, the whole breast cancer thing in estrogen, that talk comes from a very old study from 2002 called the Women's Health Initiative. It's from the Women's Health Initiative
Mm-hmm.
where um they wanted to like research hormone replacement therapy, sorry. And during this research that they did, they used older women. So the women that were part of this study were 65 years of age and older, many of them well into their 70s. And
Okay.
these women were like 15, 20, 25 years past their last menstrual period. Going that long without estrogen, you're going to already have some chronic conditions that are already advanced. So for a
Okay.
lot of these women, they already had established cardiovascular disease. Everybody knows as you age, your cancer risk increases already. And like just a whole bunch of other factors that really don't make that a good group of women to study or all of a sudden start estrogen on.
Okay.
I didn't really think that part through, and that's the part of the study that's really flawed because what happened is they started these women on estrogen, and the only estrogen that they used was a synthetic estrogen called Premarin.
Okay.
It's an oral estrogen. It's still widely used, but it's very, very old. It's made primarily from pregnant horse urine. It's
Oh
called a
my God.
conjugated equine estrogen. Sounds terrible, but it does work for some women.
Okay.
It's oral, but it's synthetic and it's old. So that's what they used. And they loaded up these women with estrogen. And of course, some of the people in their studies wound up with strokes. Now,
Mm.
that's easy to say because they've already had established cardiovascular disease.
Mm-hmm. Yeah.
So, some had a stroke, some developed breast cancer, and when they saw that, they immediately shut down the study. Unfortunately, the study was incomplete. They didn't investigate why these women had these reactions the way they did,
Mm-hmm.
why they had these outcomes. And they also didn't use different forms of estrogen. And I'm guessing it's because at that time they didn't have a whole lot of options for hormone therapy. So they had these negative outcomes and they stopped the study. And then it got leaked to the media that HRT caused cancer. They just kind of went and announced, they said, we're stopping the study. It causes cancer and strokes. So
Okay.
at that point, doctors were like, okay, we're shutting it down. Women like stopped taking their HRT in droves. Doctors stopped prescribing it. And then it was demonized. And
Mm.
And there's a whole generation of women now who have, all kinds of chronic illnesses, frailty, and, because they've missed out on being able to have some hormone replacement therapy.
Okay.
Okay, so that's where the breast cancer scare comes from. Now, that study, and I can send you some. There's also a really great book called Estrogen Matters.
Okay.
It
I'd
talks,
like that.
yep, it talks a lot about estrogen therapy, the benefits of estrogen therapy, and it even talks about it in the context of breast cancer. Um, but we now know that progesterone alone, like estrogen alone, does not increase breast cancer risk. Actually, the study shows estrogen only therapy decreases breast cancer risk by 22%.
The more you know.
It's actually
The more you know.
the more you know. And that's using body identical estrogens. So now we have something called body identical. They're not the pregnant horse pee. Right? These are estradiol, which is what our body naturally makes. And now you can get them as a patch or as a gel, which carry much lower risks of any kind of cardiovascular activity. So I use the gel estrogen, and that just goes through the skin. It doesn't pass through the liver. And that's the
Okay.
point here is that if you take an oral estrogen, it's going to pass through the liver. It produces more metabolites. There's a little bit more of an increased risk of developing a clot. But if you take it transdermally or through the skin, that
hmm
risk is greatly reduced. And
I
that's
didn't
because
know that.
the liver.
Girl, I didn't know it came in different forms. Nobody told me that
Yeah.
because my doctor wrote the prescription for the pills, and that was all I knew. So now that I know that, now I can say, hey, let's try this patch.
Hmm.
I had no idea until you
Much
just
less
said
side
that.
effects with the patch, and the risk of clot with a patch is like little to nothing.
Okay. Never
Hmm.
heard of it. And I'm so glad that you brought that up because why wasn't I given that option? Like, why do
Yeah,
you want me to take these pills so bad?
why educate?
They probably make more money. I don't know because that is literally the first time I've heard of um other
Mm,
forms, and
absolutely.
that's crazy.
Yeah. And because you don't have a uterus, you don't really need to replace progesterone.
Okay.
If you have a uterus that's intact, so you have not had a hysterectomy, your uterus is there, you must have a progesterone on board. And you can take that progesterone in different ways. So we have now micronized progesterone, which is body identical. Some women have some intolerance to oral progesterone, which
hmm
sometimes they may opt for like a progesterone IUD instead. And that progesterone is needed to protect the uterus.
Okay.
You can't have unopposed estrogen in the body. It needs to have progesterone. The uterus needs to be exposed to progesterone in
hmm
some way or another. So, you don't need it if you don't have a uterus, and you do need it if you do have a uterus. But progesterone for you, in your case, is completely optional. Um,
Okay.
some women do have benefits of taking it, even though they don't have a uterus.
hmm
Progesterone helps women with anxiety. It can help with sleep. It's very calming. So some women, if they have sleep issues or anxiety issues, they may benefit
Me.
from progesterone.
I have
Yeah.
all of them, girl. So, what are the most common perimenopause symptoms women don't realize are actually hormonal? Because once you start Googling and
Hmm.
tricking yourself and messing
Yeah.
with your mind, you think something's really going on that ain't. So, tell us a little bit about that. That way, the people in the back can find that
Yeah, so
out.
we all know the common ones, right? We all
Yeah,
know about the hot flashes, the cold sweats,
yeah,
the messed up periods. Okay,
yeah.
your periods get all messed up. But then there are other things that happen. You might start to smell funny, so
Mm,
weird body odor.
okay.
Changes in your dental. So you might
Mm.
find that your gums bleed more now.
Oh,
Or
wow.
you might have like a loose tooth. That's from like the bone loss. Osteoporosis is very significant. We lose a lot
Girl,
of bone
yeah.
muscle in
Mm-hmm.
Yes. And again, that's from low progesterone. Our bones need that estrogen. Um, so other things, itchy ears.
Mm-hmm.
Like I know
Okay.
I just want to like
Because I'm like, yeah, I've had that go on. Thank you for pointing that out. Uh-huh.
yeah.
I've had it.
Mhm. Um, sudden mental health issues.
Yeah.
Um, so sudden severe anxiety. A lot of women report that they have anxiety driving, especially at night. Um, of course, the rage, the mood swings, all of
Yeah.
that.
Yeah.
Depression, sleep issues, huge.
Oh yeah,
Sleep,
girl. I have to have a sleep aid every night. I can't do nothing but take a sleep aid because I can
yeah,
fall asleep, but staying asleep, it ain't gonna happen unless I have some form of Z-Quil or something going on. So
yeah,
yeah,
yeah.
highlight that.
Mm-hmm. Changes in taste. Some women they say they have like a metallic taste in their mouth sometimes.
Oh,
Um, Changes in body composition. So, you may have been that person that, worked out 5 days a week, ate well, like had a good diet, and all of a sudden you still have a pooch that shows up. That's the estrogen that's decided that you're losing estrogen.
yeah,
So your body is trying to like figure out how to protect itself.
yeah.
So it starts to redistribute fat. So you might
Wow.
notice that the fat from your hips is now going to your belly. Now you have this belly fat that's like, I don't know where that came from. The scale really hasn't moved, but your body composition
That
changes.
was tea, honey, because you have hit every point. And I'm like, wait a minute. I know, like, my sons are 24 and 17. Like, who's fat around here like this? So I'm glad you
Mhm.
highlighted that because I was trying to figure it out. And I know that
AKA,
I have controlled my
yep,
eating somewhat,
yep,
but that's
yep.
ridiculousness. And when you mentioned osteoporosis, I know that
Process.
my doctor said it would push me into early osteoarthritis if I did not take the estrogen. And of course,
Yeah,
my wrist. They have like this whole little thing going on my knees sometimes. But I said,
yeah.
well, hell, what can I do? Like, there is no reversal, but I need to do something while
Estrogen will definitely help help your bones not get any worse.
well, let me start taking my stuff religiously today because I was scared about the breast cancer. And now you said that's
Well,
not
make
going to
sure
do
you
it,
get
girl.
your
You can take
mammogram.
it.
Get your
I
mammogram
am.
first before you start.
Okay. Okay, I will. Because
Highly
it's
recommend
already
get
on the
your mammogram.
calendar.
Yeah. Um,
Okay.
and then of course we get the pelvic issues. So, we're always running to the bathroom. So the
Yeah.
urinary urgency. Some women develop urinary tract infections.
Mm.
Um, like frequent.
Yeah.
Of course we're a little drier down there. It might hurt. Um,
Mm-hmm.
more uncomfortable, might take longer to get there.
Yeah.
Yep. Maybe it doesn't even work anymore. I don't know how graphic I can get on here, but
Thank you for
but we
throwing
all
it
know
out
which
there.
the body we're talking about.
Yes, because we were going to talk about low libido here in a minute.
And
Because I
yes,
got
low libido.
questions.
And the other thing that a lot of women don't realize is that the inner labia, so the inner
Yeah,
lips,
yeah.
those actually start to like disappear a little bit.
No, no.
And the clitoris starts to shrink.
It's not working. Oh, don't say that. Nobody has told me that either. My doctor has failed me because I probably would have looked like So this don't look right. So what's happening here? I probably would have thought I was morphing into something.
And some women need to have vaginal estrogen along with systemic estrogen to help those symptoms down there. So
Child,
I'm
we are
actually on
toe
both.
up.
I'm
We
on
are
both.
toe up. Are you?
Yeah.
Never heard of that other one. I'm so in the dark, girl. I'm so tired. I am in the dark about my health and what comes with what and how this works. I'm just actually learning as I go for real. But you are
Mhm.
giving me so much knowledge right now. And I'm so appreciative of it. And I know there are girls that are like, damn, that's what that meant. Oh my God. That's what, child, we need to know it all. We need an open book session real quick. So
Right?
what's the earliest signs do you see that makes us say, you know what, yep, this is perimenopause? Because again, you can be going through something just simply hormonal, but then you
So,
can also be going into full perimenopause and won't even know it. So, what signs usually stand out?
so most women are prompted to go to their doctors if they still have a uterus. Most women
Yeah.
are prompted to go to their doctors because there's been a significant change in their cycle. So a
Mm,
lot of
okay.
women, they start to have what they call the crime scene periods. And
Ooh.
that's purely caused because estrogen and progesterone are just becoming wildly unpredictable in the
Uh
body.
huh.
So you're getting ovulation sometimes twice in a month, right? So your periods first start getting really close together. That's one
Mm
of the signs. So like you might have a period and then maybe 12 days later you have another one. They're really heavy.
hmm.
So oftentimes
Mm-hmm.
that's one early symptom that women will go to their doctor and say, "Hey, something's up."
Mm-hmm.
Um, Other symptoms like, they just feel off. Like a woman
Yeah.
doctor and say, I just feel off. I'm really, really tired. I've gained weight. I feel anxious. I don't know what's wrong with me. Um, and then, like, if your doctor is in tune with screening for perimenopause, they will actually try to rule the other things out first. So if you show up at
Okay.
your doctor and you're saying, "Hey, I'm tired. I've gained weight. My periods are a little messy. I'm, low libido or no energy, all the things." A doctor should be ruling, and some women actually, another symptom I forgot to bring up, some women get heart palpitations.
Oh my
So,
God.
um, so they go to their doctor, and what should be happening is that your doctor should be doing a physical. Your doctor should be,
Mm-hmm.
making sure that there's no masses anywhere. They should be checking your breasts. They should be, if they have to do a cervical, exam, do a cervical
Yeah.
exam. And then they should be sending you for blood work.
Mm-hmm.
It's really, really important that you know your numbers, that you
Yeah.
know what your fat levels are in in your blood. I'm going to call it blood, but it's actually your triglycerides. So it's really important to know those levels, that your triglyceride level, your cholesterol, because cholesterol changes for some
Mm-hmm.
women. It creeps up. It's important to know your blood pressure because that starts to creep up in perimenopause.
Mm-hmm.
It's important to know your fasting blood sugar and your A1C, and that is the
Okay.
marker for diabetes or insulin
Okay.
resistance. So, especially us Black women, insulin resistance and metabolic syndrome can start to become a problem. So, that's definitely a number that you should know. And they also should be running things like, checking your liver, checking your kidneys.
Mm-hmm.
Some women, if they're having cardiac symptoms like heart palpitations, the doctor should be looking to make sure that the heart is fine and that there's no other underlying medical condition. So basically, before you want to step out and say this is perimenopause,
Yeah.
you should have a physical done and rule everything out. They should be checking your thyroid as well.
Mm-hmm.
Because a lot of symptoms in perimenopause can mimic some other things.
Okay, that makes
So,
sense.
yeah, there's a lot of like perimenopausal symptoms that can mimic having a low thyroid or low
Mm.
iron, right? So there's lots of like things that your doctor needs to rule out before we can just say, yeah, this is perimenopause. Now let's treat.
Yeah. Yeah, for sure.
Yeah.
Okay. So, are there any other options outside of hysterectomy when it comes to fibroids? Because like I said, I didn't really understand what was happening to my body. I was like, well, how did these happen? How did this come to be? I don't know if it was because I had my tubes tied when my baby boy was a year old. I don't know if
Mhm.
that's what triggered it, but is there any way that we can kind of steer away from a hysterectomy and try to do like homeopathic, or like, is there anything where we can literally shy away from starting to deduct from our bodies?
I'm going to be honest with you, there really isn't a whole lot of good studies on homeopathic and treating hormone
Yeah.
things. There's mixed evidence with some herbs like red clover and black cohosh, evening primrose oil. Those are sort of the three standard ones that come
Yeah.
up. But you really have to be careful. black cohosh, like for instance, can actually become toxic to your liver.
Oh my
So if you
God.
take too much of that, you can actually induce liver failure. We have because the problem with supplements is that they're not regulated.
Yeah,
We
yeah.
don't know what's in it. We don't know how much is in there. We don't even know if what they're saying is in there is actually in there because
Mm-hmm.
they're not tested the way they should be. Not like
And it's the
pharmaceuticals,
game of pharmaceutical. So yeah, they're
right?
definitely gonna say
Yeah,
whatever.
and when we look at the wellness industry is like making tens of billions of dollars more than the actual pharmaceutical
Yeah,
companies, right? So there's a lot of
crazy.
people out there that are pushing all of these supplements and stuff. Oh, this will help you in menopause. This will help you. You might get a little bit of a relief, but a lot of the time it might be something called the placebo effect,
Mm-hmm.
and then it's just not working anymore. But really, to treat hormone deficiency, you have to take hormones.
Yeah.
Um, Hormones are not appropriate for all women. There are some women who should not take hormones, and those women are like women who have active breast cancer, women who've had or active uterine cancer, uh,
Mm-hmm.
women who have established cardiovascular disease. So if you've had a heart attack or if you've had a stroke, you're not a good candidate for HRT. Um, if you are very prone to getting blood clots, probably not a good idea to be on HRT. You
Yeah.
could talk to a provider about maybe a transdermal form, but they probably will shy away from it anyways.
Okay.
Vaginal estrogen, however, the stuff that goes inside the vagina to treat all the vaginal and sexual things,
Yeah.
um, is safe for about 99% of the population, even for women who have had breast cancer. And the
Okay.
reason is because vaginal estrogen does not go systemic in the body. It stays
Hmm.
local to the vagina.
Okay.
So it treats all the things down there. So even if you are not a candidate for systemic hormone replacement therapy and you still have some pelvic issues, you can still treat that most of the time with vaginal estrogen with little to no issues. Um, you but as far as like supplements and stuff, the evidence is so mixed on all of that, and a lot of it just
Yeah.
isn't that great. I don't really steer clients towards doing supplements. If I feel that if you are going to take a supplement, make sure that you're actually deficient in something before you
Mm-hmm.
take it. There's a couple of things I do say to clients that you do become deficient in as we age, and one of them is magnesium. So
Uh-huh.
magnesium is great, especially taken at night. It can help with some sleep. It can help with bone health and brain health and heart health. Another one is vitamin D. So get your vitamin D levels tested. If your vitamin D is low, then you're definitely going to want to have some of that on board as well.
I'm glad
Um,
you said that because I did my blood work a couple weeks ago and it came back. My vitamin D is typically low. I don't know why, but I have went and got me some more of my daily women's vitamins through
mhm.
Centrum. So I'm definitely working on that heavily. But yes,
Yep.
for sure, that vitamin D is
Vitamin
always
D
low.
is very important. It's important for our bone health. It's important for heart health. And it actually helps our hormones in general.
Okay.
So and it helps our brain health too. Especially if we have like some mental health disorders. The
Mm-hmm.
vitamin D is especially important, especially in the winter months. Uh,
Okay. Hey.
right? Because vitamin D is something that we actually make through our skin. Unless
Mm-hmm.
our food is fortified with it, we don't really consume a lot of it.
Mm-hmm.
Um, so making sure that we have adequate vitamin D is really important. And us being of color, we really are not making it as quickly as some other people. Um,
Okay.
so we have to really make sure that we are not deficient in that. So yeah.
So basically, get your vitamin D up, girls, because
Get
we
your
need
vitamin.
it.
Yeah, yeah.
Okay. So, what is a myth about perimenopause? Because, there's always somebody speaking scientifically that could be lying to us, but we don't know the difference. So, in your opinion, what would you say a big myth is about perimenopause? We probably
Oh,
thought we was gonna die when we first was diagnosed because I was like, perimenopause. I'm old. I mean, I got a short lifespan. Like, what do you think would it be?
peri- perimenopause. I think the biggest myth I hear is that, oh, it's for women over 50. But it's
Yep.
not. Because when you're over 50, then you're in postmenopause. You're not even in
Yeah.
peri anymore, right? Um,
Right.
menopause is 1 day. So menopause is day 365 that you have not had your period. You have to
Okay.
be a whole 12 months consistent, like consecutive 12 months without a period to be considered in menopausal or postmenopause.
Okay.
And then after that, you're in menopause for the rest of your life. So people think that they only go through this for a couple of years and they're over, and they're
Right.
not. You're postmenopausal for the rest of your life. You are going to have consistent low levels of estrogen
Whew.
for the rest of your life. It doesn't end. We spend
Mm-mm-mm.
30% of our lives, if we live long enough, we spend 30 to 40% of our lives post-menopause.
Well, that's what keeping it real goes wrong because you just kept it out of the way real, and where it went wrong is now I'm like, oh my God, this is a forever thing, which
Yeah.
I assume so, but I
So
really didn't
why
know for
would we
sure.
want to live the last 30 years of our life in chronic pain or feeling like crap?
I
You know,
know.
women live longer than men, but we live with more chronic illness than men.
We sure do. And again, the
Right.
gods are working against us. Why y'all mad at us? Like what we do?
Right.
Like,
Exactly.
you know what I'm saying?
Yeah. The nursing homes are filled with women who are in wheelchairs because they all have severe osteoporosis and
Yep.
fall risk and actually the leading cause of death in women is actually heart disease, not breast cancer.
Wow.
So we are actually more at risk of dying from something of a cardiovascular nature than breast cancer.
Wow. That was a lot of information because again, you don't hear this from your routine physician. You don't hear this from
Mhm.
other people that may have experienced it because nobody knows until they're in the thick of it.
Right.
Nobody forewarns us about certain ailments and what could happen and what you're going through now and the fact that it's never going anywhere until it's too late. And you are really shedding a whole lot of light. And I hope that, the viewers, my teacups, I hope that they take heed to everything that you're providing because it's important. And we've been in the dark. We have been in the dark.
And just some of the benefits of like being on hormone replacement therapy. So, we know for sure that hormone replacement therapy will actually prevent and help
Hmm.
treat osteoporosis. So it's
Hmm.
actually indicated for that.
Okay.
Um, and we're just talking about estrogen here. So I'm not even going into like progesterone and testosterone. I don't want to
Because that's a
confuse
whole nother
a
thing.
whole other time.
Yeah.
But estrogen in itself um, can prevent and treat osteoporosis. So we know this. Uh,
Hmm.
lots of studies also indicate that estrogen protects our heart and our blood vessels. So
Hmm.
estrogen keeps our blood vessels elastic so that they move nicely and that the blood moves nicely through them. Because without estrogen, they become stiffer, and that's where high blood pressure comes in. Um,
Uh-oh.
more pressure against the walls, they're not as elastic. So it does help have some cardio protection. We know
Okay.
that estrogen helps us maintain some of our muscle mass. Um,
Hmm.
we lose with aging our muscle mass. So it helps us keep some of that muscle tone. We know it helps our brain, right?
Hmm.
We have, like, I mean, have you ever heard people say they have brain fog?
I
Can't
was
come
getting
up
ready to ask you
with
about it. Oh my God,
can't,
you must have knew it. I was
can't
gonna
come
ask you
up with
about brain
words.
fog, girl. We got to talk
Word,
about it.
you're skipping over your words. You don't know what to, you don't know how to explain things, or you just completely
Or you
forgot why you
forget.
walked into the room. Why am I here? Why am I in this? Why did I come out here again? Can't
Girl,
remember.
what is it? What is it? Oh my
That's the
God.
loss of estrogen from the brain,
Oh my
right?
God.
So our brains are filled with these estrogen receptors, and as we lose estrogen, those brain receptors are like misfiring because they're like
Mm-mm-mm.
They're like, what's happening? The brain loves estrogen, and there's another book called that was written just about brain health. So I can share all of that with you after
Absolutely.
you're done if you want to put it in your show notes or whatever. But
Yes.
there's some really good resources out there, and the 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 brain is just needing all this estrogen. So there's some studies now being done where they're starting to link maybe early dementia with loss of
Mm.
estrogen, mental health issues. That's why we have the mental health issues, because estrogen helps create the neurotransmitters
Mm-hmm.
that keep our mental health in check. So estrogen helps serotonin in the brain, which is our happy hormone.
Yeah.
It also regulate dopamine, and it helps
Mm-hmm.
regulate other neurotransmitters in the brain. So we know that hormone replacement therapy does in fact help with a lot of these symptoms that we experience. I know for myself, I started HRT about 2.5 years ago. Had really bad brain fog,
Oh my
really bad.
God.
Couldn't sleep. I wasn't sleeping. Really bad joint pain. Hot flashes were terrible, awful. They kept me up at night. The
Yeah.
hot flash to a cold sweat, and I'd have to change my nightie and my
Yes,
sheets, and
ma'am.
terrible.
Yes, ma'am.
Um, I've I it so when I went on hormone replacement therapy, I would say probably within about 3 to 4 months, a lot of these symptoms subsided.
Oh,
Um,
that's what I need.
Reduces symptoms by about 70 to 80%. So it doesn't completely take them all away, but it
Yeah,
does
but
take a
it
majority.
helps tremendously.
Definitely has improved my quality of life for
Okay.
sure. There are other things that I'm experiencing with perimenopause that the estrogen therapy isn't quite correcting, and I have to correct those in other ways. Like I have like some metabolic syndrome that's developed, and estrogen doesn't really take care of that, especially
Yeah.
me as a black woman. So I've had to look at some other ways of managing that, but um, you know, it does help reduce a lot of those symptoms that make life difficult for women in menopause.
Yeah.
That being said, if you're not a candidate for hormone replacement therapy, there are other off-label medications that they can use to
Mm-hmm.
help with hot flashes, to help with anxiety, to help with sleep. So there are other medications that they can use to help if you are not a good candidate for hormone
Okay.
replacement therapy. Again, those are conversations that need to happen with your physician, and
Mm-hmm.
hoping that your physician has this information to actually tell you,
And if they
right?
don't, you need a new physician because now we need to know how do we find out if we're a good candidate. So the people got to let us know.
Exactly.
And if not, we need to find us a new
Yeah.
physician.
And then of course there are other ways that women need to support their bodies in perimenopause as well. You have to look at your nutrition. You got to make sure our nutrition needs change. So, what's your nutrition like? Now you have to like maybe up your protein,
Mm-hmm.
because now we need more protein to help maintain our muscle mass, because we're losing muscle
Mm.
mass, right?
Yep. And having to
So
get
we
bone
want to
density scans like I
yeah,
did.
exactly. So we need to up our muscle mass. So we have to eat protein to maintain that. A lot of women, we actually require more protein. Fiber, we need to up our fiber. Fiber is going to help with, the visceral fat or the belly fat that sometimes that shows up for a lot of women.
Yes.
But fiber becomes really essential. It also helps reduce cholesterol and other things in our blood that are not so great. It helps
Yeah.
with regulating blood sugars. So we have to up our fiber. Um, we need to make sure that we're hydrated. We need to make
Yeah.
sure that we're sleeping. Sleep is really, really important. So we need to like find ways to manage stress. It becomes really important for us at this age or during this time to manage stress in our life. We need to triage what's important now and what really isn't that important anymore.
Yeah.
And
Like stop stressing
find
out,
those things.
please.
And putting those things in place that bring us joy every day so that we're not stressed out, because
Yeah.
if we continue to live in a stressed state, that stress is actually going to impact our bodies as well. It's going to make it harder to lose weight, it's going to affect our sleep,
Mm-hmm.
It's going to affect, other hormones in our body that we need to keep supported. So stress reduction and sleep become very important. I
Okay.
protect my sleep at all costs. I
Yeah.
don't care what's
Because we be
going on,
tired.
what's happening. I am going to bed.
Yeah.
Um, you
At
know,
whatever time.
Yep. And I try to keep that consistent, like seven
Yeah.
days a week. Doesn't matter if I'm getting up on a Saturday or on a Monday. I need to keep my sleep consistent.
Yes.
But that's very important to me. And of course, the one of the most important things is getting regular activity. So
Mm.
making sure that you're moving your body intentionally, whatever that looks like. Strength training is recommended, highly recommended, because strength training helps you maintain your muscle mass and build
Mm-hmm.
muscle, especially if you have osteoporosis or low bone density. You're
Uh-huh.
going to look at strength training. Strength training is going to build that muscle mass, and by building muscle mass, you're actually going to increase your metabolic rate. So you're going to
Okay.
increase your metabolism, and that over time is going to help you burn body fat, including that annoying belly fat.
Okay.
Um,
Because we want to get it off.
so
Summertime is coming, girl.
Yeah, and now they
Summer's
say that
coming.
like a lot of the research is like muscle is your longevity. So as long as you're
Mm-hmm.
building muscle, that's going to really help you stay mobile. You're going to keep your independence. And a lot of clients that I work with, that's now their goal. The goal is no longer just weight loss. They want to be independent as long as they can. They want to be strong.
Yes.
They want to be able to get off the toilet when they're 80 years old. Like this is why they're working out.
Yeah.
So we need to make sure that we're moving our bodies consistently as well. So those are some other lifestyle factors that also need to be considered, as well as, of course, hormone replacement therapy or other pharmaceuticals if you're really struggling with symptoms.
Okay. All right. So we've already touched on hot flashes and things like that, but this is a segment that I like to call Tea with Tish Rapid Sip, the fun and real. So with the
Okay?
hot flashes and night sweats, what can we do to decrease them? Like, okay, we've talked about all these things that we can input and all of that, but in between that, other than keeping all the fans on and having your electric bill up through the roof, what else can we do? Is there anything that can work hand in hand
Yeah,
until all
is
of the good stuff settles
yeah.
in?
Okay, so we've talked about all the good stuff that you can do to that comes in that you can help. However, you can get some breakthroughs.
Okay.
Um, and the most important thing I say with that question is to know your triggers.
Okay.
So, some women have triggers that induce hot flashes. So for me, it's sudden stress. So a sudden
Huh.
stressful event. Um, for instance, last night, it was so dumb. But anyways, I was getting ready to go out for dinner with my husband, and
Yeah.
I'm all dressed up. I've got my like, nice gear on and everything, and
Yeah.
I am looking for my shoe, the shoe I want to wear. Yeah,
Right.
it. And I'm going through like my shoe trunk, and I can't find this shoe, and all of a sudden, I
You're just
just
like,
break
whoosh.
with sweat. Yeah, I
I
literally like
know.
induced a hot flash at that moment. It
Yes.
was like, oh my God. Um, Another trigger for me is alcohol.
Mm. Yeah.
Alcohol, especially red wine.
Um.
Um, one glass of red wine, and I am your personal furnace.
Oh my God.
I
Are you like, oh,
am
let the
literally,
windows up.
yeah,
Open the
I am
doors.
literally that woman. I don't know if you've seen that meme, but that meme of that black woman, that bald black woman, where the steam is coming off her neck. That's me.
Oh my God. I'm gonna have to check that out because that's gonna give me all the laughter and jollies I need.
But
I
for a
have
lot
not
of
seen
women,
that.
alcohol is another trigger for hot flashes. So, um,
Mm-mm-mm.
to help treat hot flashes is one thing, but to know what prevents some of them is a
Mm-hmm.
really big thing. So, like I tell clients, journal your symptoms, journal when they happen and
Yeah.
how they happen, and that gives you a really good idea of, oh, yeah, the last 3 times I had a glass of red wine, I like had a hot flash, right?
Yeah.
And then
I
you
need to
can really
start doing
start,
that. I've never heard of that either. You see how
yeah,
far off
start
I
doing
am?
it. Journal your symptoms, and then like
I
you can
am.
start making links as to like what may induce the hot flash for you.
Mhm. Okay. So if a
Yeah.
woman is quietly struggling right now, what's the first step um that you want to literally get her in gear? How do you want to assist her in saying, "You know what? Since you're struggling, sit right here and
Mhm.
let's talk about it." How do you prep her for what's to come?
Yeah. If you're struggling and you're listening to this and you're thinking, yeah, I need to do something, or like just really struggling, I really recommend, first of all, getting yourself educated.
Yes.
Find some
Yes.
kind of source or some resource. Start reading. Like I said, I'll give you some um, resources that you can drop in your show notes.
Okay.
But I would there's a few books out there that I would recommend that you start reading. There's actually some really good documentaries out there now. I don't know if you have access to it or not, but one of them is the M Factor.
Okay.
Um,
I'm gonna have to
that's
check
a
it
really good.
out.
I think it was on PBS. It may still be there.
Okay.
Um, the PBS in the United States, I know, was carrying it. So, um, the M Factor is definitely a good documentary to watch. There's another docu-series now on Apple TV. It's called Balance,
Okay.
and that actually just got released 3 weeks ago, and that is phenomenal. I love it. It's on Apple TV. That's a really good source of information too, and a lot of the clinicians that speak on that have been sort of the driving forces in the menopause world. Um, if you really want good information from a Black healthcare provider as well, Dr.
Yeah.
Sharon Malone is fantastic. I give her a follow on Instagram. She's really good
Okay.
at giving tea as well. Um, and then start writing things down. Start journaling your symptoms.
Okay.
Write down, journal your sleep. If you have like an Apple Watch or an Aura Ring or some kind of health tracker,
Mhm.
um, start paying attention to some of those um, measurements that it gives you.
Okay.
Some women develop things like sleep apnea in
Girl.
menopause,
I know
perimenopause.
somebody pissed off right now, like, oh my God.
Yeah,
It's
sleep
like,
apnea is another thing that we develop. So,
yeah.
that really does affect sleep too. So, monitoring our sleep, monitoring our symptoms, and the more information that you can educate yourself with, and the more that you start to write down your symptoms and be in tune with your body, the
Mm-hmm.
more you're going to have to present to your doctor.
Yes, for sure.
And walk into your doctor with your information, with your book, with whatever medical journal that you've read or whatever, and your symptoms, your tracking of
Mm-hmm.
symptoms and stuff, and you have a lot of evidence with you to go to your doctor and say, something is up, I don't feel good, I'm really
Yeah.
struggling, I need this looked at. Here's my information. And the
Yeah.
more armed you are, the better you're going to be at advocating for what you need.
Mm-hmm.
And the
So
more
when they ask you,
information
what questions do you have? What's going on? This is it. All
exactly.
53 pages. This is it.
This is
Yeah.
it. This is it here. Um, and then if you find that your doctor's gaslighting you, go to another doctor.
Yeah. They have several out there. They didn't
You
stop
know,
when they made you a
they have
doctor.
several out there.
So,
And I believe there's a lot of telemedicine now happening in the US for women
hmm,
who might live in rural areas that don't have access to a doctor or a gynecologist, and they're fantastic at, looking at women's health.
yeah.
You really are looking for a menopause specialist, somebody who
Hmm.
for sure knows what they're doing. If you go to the Menopause Society webpage, I can send that to you as well.
Okay.
But if you go to their webpage, you will find a directory. And in that directory, you can put in the state you live in or the province. I'm from Canada, so it's provinces up here. But you can put in where you're from. Like it's good for North America, so anywhere in
Uh-huh.
Canada and the US. You can put in where you're from, and then even as much as the city that you're in, and it will
Okay.
list all the providers that are linked to the Menopause Society.
Very helpful. Very helpful. Okay.
So there's a
So,
couple of things that you can do for sure to kind of get the ball rolling. And of
yeah,
course, find like people on, I mean, there's lots of people online that are talking about it, but you really need to find the good ones. The ones that are
absolutely. Well,
actually
thank
giving
you.
the good information out there, right? So,
Yes. Well, thank you so much for that information. And I'm sure a lot of people that are going to be watching will find all of that helpful. So, what's the biggest takeaway that you want every listener to leave with after this conversation? Because, again, this was near and dear to me because I live it. And for those that are coming after me or those that are just now hitting the scene of perimenopause, what's the biggest takeaway that you want them to get after watching this? I hope a lot and sharing it and all that.
I, I want every woman out there to know that A, she's not alone. You are not alone. Don't
Hmm.
feel like you're alone in this at all. Find community, start talking to other women. The more we talk about it, the more we share our story, the more
Yes.
we're going to empower each other to want to, live a better life,
Yeah.
longevity. Um, and I want women to know that they can be empowered to be their own advocate.
Hmm.
It's very hard for a lot of women to walk into a doctor's office and tell them what they want.
Absolutely. And get it.
And women, yes, and get it. And
Hmm.
women need to feel empowered and know that they are in that's their body. It's
Yeah.
your body, right?
Yeah.
And you know what's going on with your body. Make a lot of noise. Make
Yeah.
noise. Don't be afraid to make noise. And it's
Yeah.
intimidating, right? You're dealing with somebody who's gone to school for a decade and they're doctors
Yeah.
or whatever, they're experts. But I'll tell you right now, not a lot of doctors are experts on this.
Yeah. And a lot of them have never experienced this. So,
No,
yeah.
no. I mean, that's a completely different podcast when I want to talk about like what doctors have said to people. But
Oh my
I mean,
God. Mortifying.
you're right. Right? It's just, like women get gaslighted, and
Yeah.
it it is perfectly okay to ask for that referral. It's
Okay.
perfectly okay to say, you know what, the treatment that you're giving me is not working.
Hmm.
I need something else, or I'm gonna go somewhere else. Or
Yeah.
yeah,
Put
and
your
I'll be
foot
honest
down.
with you, I've had to do that with
Yeah.
my family. I've had
Mm.
to really fight to get HRT because he's like, "You're too young." And I'm
And
like,
I'm
"Yes,
telling you
but."
what I need, so don't tell me, like, stop. I'm letting you
Exactly.
know what I'm going through. So listen to
Guess
me.
what? He even forgot I had a partial hysterectomy 11 years ago. He forgot.
Wow. And it's in your notes. It's in your records. Like what? You're not looking at them?
He goes, "Well, you have ovaries. You should be okay." And I said, "Yeah, but the research on that tells me that that's not entirely the truth.
Right.
Like, I have ovaries. Everybody, like, we're starting to know, understand, and realize
Yeah.
that surgery impairs the blood flow to the ovaries. So they're
Mm.
going to fail a lot sooner than at
Wow.
50."
Girl, I
Right?
done got so much knowledge today, and it's like nobody tells you that. Like I said, if you knew the secret on getting better, there would be no doctors in place. They would start losing money, even though people still
Absolutely.
need them. But just like the
Yeah.
pharmacy, if nothing's wrong with you and you don't need medication, what are they gonna do? They
Yeah.
still need to work. So it's like whatever's making you better, they're not really gonna give you the secret. They're just gonna give
And
you like a little
I
seed
want
filler.
women to know that needing to take medication or needing to be on hormone replacement therapy or needing, if you have metabolic syndrome and you need to go on a GLP-1, you know
Yeah.
what? There is zero shame in that.
Yeah.
There is zero shame in that. What you are doing is you are improving your health so that you can live a better life.
Yeah.
Nobody wants to live their life in pain. Nobody wants to live their life with chronic illness. Nobody wants to live like that anymore,
Mm-mm.
right? That we're changing, our generation is changing the face of aging
It is.
tenfold,
Yeah.
right? we're figuring it out. We're living better than our even our parents are. So
Yeah,
it's really like important for us to just keep that momentum and finding community and educating ourselves and finding that advocacy within us to fight for what we want, for what we know that our body needs.
absolutely. Absolutely. Well, to pick it up on a more fun note, this is about the time of the show where I ask about a fun fact about my guest. And now that you've been on my guest, you're now a teacup. You're part of the tea collection. So
Oh, love it.
we want to know what's a fun fact about Amanda that you may want to share or that people think they know, or maybe they don't know. You just want to clear up. Don't say you played the clarinet or drove trucks or none of that, because I'll be like, yeah, right. But if it is, it is. But give us a fun fact about you.
I actually was gonna say I play about 6 instruments, but that
Do you
I
really?
mean, yeah.
Okay, which ones are we playing? Guitar? What we doing?
So my natural instrument is an organ, and then
Wow.
I have like my grade 3 I have my grade 9 conservatory, grade 3 theory, so
Okay.
piano as well. Um, bass clarinet, tenor saxophone,
Wow. That's
bass,
amazing.
bass guitar,
Oh,
and I've
wow.
played drums a little bit, but yeah.
You need to start a band, girl.
And
I'll
music.
be on the mic. I'll do the mic. I can't play nothing, but I will be on the mic,
Well,
getting everybody in line.
kids. I don't know if that's a fun fact either, but 3 kids.
The funnest fact of all is when they are of age to where they're outside of the house. That's the fun fact in that,
Well,
girl.
I'm waiting. I'm waiting. I have a 20-year-old, an 18-year-old, and a 16-year-old. So,
Hey, they on their way. If they're not out of there yet, that's a fun fact. So salute to all the mothers who are almost empty
through
nester.
the going forward. So let's see where that goes.
Okay, well, honey, we're gonna always hope for the best. Listen,
I
I
know.
want to thank you so much for carving out some time to tea with me
Yep.
today. And honey, I
Anytime.
needed it. Feel free to message me some information because you know I'm gonna need it. If you don't
Yes, I
reach out to me,
will.
I'm gonna reach
Yeah.
out to you. Is there
Mhm.
anything else that you want everyone to know while we have that time?
Yeah, I mean, I of course I encourage everyone to give me a follow on
Yeah,
Instagram.
they did it.
I'm not on there pushing, wellness supplements or
Right.
I'm there for the education. Yeah, I promote like, my coaching and stuff like that. I do offer
Yeah.
coaching for women who are really struggling and need someone to like really guide them through this process. I don't
Yeah.
prescribe medication, but I do like help women get there and get to a place where they're feeling good about themselves again. And like I do that with like nutrition support and fitness support, and because I'm also a personal trainer too.
Uh-huh.
So fitness support, education support, all of that, all the things menopause is all put together. So the medical side, the fitness side, the nutrition, it's all together with me. So
Okay.
I address everything. That being said as well, like I do that, as far as one-to-one coaching, and I also do that with like my Hormone Harmony Hub. So that's a monthly subscription. You come into a private group. I dump all kinds of education in there, nutrition support again. It's a small little community right now because I literally just got it up and running.
Okay.
So there's a couple of ladies in there, but they're really enjoying a lot of the information that they're getting, and they have access to
Yes.
my online class. So I'm all about providing education in many different ways that women can get it, whether it's and for many different budgets, right? So if you can't
Okay.
afford a monthly subscription, but you still want education, I have a online masterclass. It's a one-time fee. You always have access to it.
Okay.
Um,
And
and
how do
then
they
there's
get
the
there? How can they subscribe and things to the different
so
helpful
if you go to my
communities?
website, I can give you my website as well, www.menohealthnurse.com. You could go on there and you can check out the master classes, the coaching, and the Harmony Hub. So there's something for everyone at different price points. I even have some free content on my website that you can download. So like I recognize that not everybody has the funds to doll out for one-to-one coaching,
Yeah.
or the monthly fee on the group is like 27 Canadian, so probably around 19 US a
Okay.
month.
Okay. That's not bad at
Um,
all.
all my all my prices are in Canadian dollars, so just so you know
Okay.
that. So in US,
Hey.
it's like
Right.
34 to
They can Google
34.
it what it is. Shoot. But you said
Exactly.
$19 US, so that's not
19
bad at all.
Canadian, so whatever that is in US. But yeah, I'm really like my heart is really led to just make sure women have the education. So of course my Instagram, I post all kinds of educational stuff on there. So
Yeah.
it's not medical advice, but it is educational. So just some, tidbits here and there that you can take away and learn. And yeah, I would
Okay
love to
then.
anybody. I'm really good at responding,
Absolutely.
as you know
Yeah.
that.
You
I
will. You
try to,
definitely do.
yeah, I try to respond to people in real time. Like I mean, it's busy sometimes, but
Yeah.
there are people that just randomly reach out and ask a question. I don't mind. I don't
Okay.
charge for that.
Okay. Well, we definitely love
Like
that, girl.
yeah.
Well, I'll
I mean,
definitely.
it's so important for people to feel connected. You know what I mean?
Yeah.
There are some people that really have complex questions, and I'm like, why don't you just book a 30-minute free call?
Yeah.
Free
Please and
call.
thank you. Yeah.
Um, some do, some don't, and that's totally fine.
Yeah.
But yeah, yeah.
Well,
My
again,
goal
I
is to
appreciate it.
get the word out.
Absolutely. I'm always share, especially if I see something that you've posted that I think someone may need to be made aware of. Because again, we're all in this
Mhm.
together. No woman is left behind. And
Absolutely.
perimenopause,
And
menopause, all of those things.
and for February, I've really really tried to make a lot of my content highlight some of the challenges that Black women even
Yeah.
go through in menopause. That's a little more specific to us because I mean we're not part of the research,
At
so
all.
we have
At all. At
so
all. Yeah. Well, thank you so much for your time again and
you're
again.
very
Like I said, thank you for being a part of the tea collection. I will make sure to share whatever you have going on because some woman needs a lifesaver, and you definitely are that. If there is nothing else, I would like to close out as I always do. Make sure that you always have enough room in your teacups for new tea because I always keep it. As you see, you never know with me who's going to be on the show, who, what, where. You don't know what we're going to be talking about, but just make sure that you are tapped in and tuned in. And that is all for me and Miss Amanda. Make sure that you give her a follow and catch T because she's here to save lives. If there is nothing else, have a great and amazing day. And we're gone for now.
welcome.
Bye.